So let's go into our progression of ARDS here, okay? So with acute respiratory distress syndrome, we have a few things going on here, okay? In the early stages of acute respiratory distress syndrome, we have pretty much fluid accumulating interstitially in the pulmonary spaces. So interstitially means it's not in the lungs yet. It's actually surrounding the lungs. All this fluid, all this blood, all this pus, white blood cells is surrounding the lungs. So fluid in interstitial spaces, we call it. You have next is your second phase, and second phase through your fourth phase is called your late. So this late phase, that fluid now shifts into the alveoli. So now there's just wet alveoli, and you can hear it with crackles called crackles of the lungs. So your patient can be in ARDS, but they might be in an early stage where their lung sounds perfectly clear, and they don't sound like they are having any respiratory problems. Maybe they're having decreased breath sounds, but it sounds like, there's no crackles. It doesn't sound wet at all. 2 days later, your patient might have now fluids in this alveoli because the alveoli themselves have been damaged. Next 10 days now, oh man, did I mess up? Oh yeah, no, it's okay. Next 10 days, you have fluid that has increased in the lung itself. So you have pulmonary fibrosis, which just is a fancy term for your lungs themselves have almost been like burned. It's almost like you've taken a lighter and burned a piece of paper. Now, how do you go back and unburn a piece of paper? You can't do it. You can't just stick a Band-Aid on your homework after you've burned it and think it's going to be better. So patients who have progressed into the third and fourth stage of ARDS usually do not come out. I'm not going to say usually because they will constantly, chronically have burned lungs. This might even lead to an entire systemic inflammation, also called SIRS. But ARDS is really just an inflammation of the alveoli itself. And once this progression happens, you can have inflammation of the entire respiratory tract. When this inflammation happens, all the fluid that's on the interstitial spaces on the outside of the lung tract will actually shift into the lungs itself, causing a breakdown. So not only are we having total inflammation of the respiratory tract, we're also having and could lead into multiple organ disease syndrome, what's called MODS. Multiple organ dysfunction syndrome. So really, when I'm talking to you guys, and hopefully all my lectures, you guys understand that oxygen is the money of the body. Without oxygen, you guys cannot live. Without oxygen, nothing in your body can live. So, in the fourth stage, your PaO2 is less than 60. So you're very, very hypoxic. It should be at least 80 to 20. Your pH level is less than 7.30, meaning that you're very acidic. Why are you acidic? Because all that CO2, all that waste that has been, basically your body has dropped off oxygen to the distal portions of the body, to the organs, and your body's trying to transport that CO2 back to the lungs and breathe that CO2 out. So, how is that CO2 going to be breathed out if your lungs now are pretty much screwed? Your lungs are pretty much charred. There's no exit for your CO2 to get out. So you're going to be very acidic. You're going to have high carbon dioxide in your bodies. So your CO2, your carbon dioxide, is going to be greater than 50. Really, really high acid. Your pH is going to be high acidity as well, leading to no oxygen exchange. So we're holding on to that CO2. We're not exchanging it for oxygen anymore because we burned pretty much our lungs and we burned our production line of exchanging oxygen. So it's almost like if you go to the supermarket or go to the farmer's market and you want to exchange money for fruit, right? Let's just say someone burned down the entire farmer's market. There's no more products anymore. You're not going to be able to exchange your fruit for your money. If someone burned down Walmart, if someone burned down the next grocery store, you're not going to be able to exchange anymore. Does that make sense? You're not going to be able to exchange that carbon dioxide in the body, and you're not going to be able to get that oxygen. So what we usually do is the patient will be on a vent for the rest of their lives, and we're trying to breathe for them very minimally. So if we catch it before your patient goes into pulmonary fibrosis, or the scarring of the lung tissue itself, it really depends on how far along this pulmonary fibrosis is. Can we catch it? Can we reverse some of the side effects? Can we give your patient something that will help decrease the inflammation of your alveoli and your respiratory tract? So let's talk about some of the therapeutic modalities of what we do with patients in ARDS. Let's do it.